This video is going to cover a mandibular guided smile arch using our LITE product. LITE is the resin-based version of GuidedSMILE, where the fixation base and the osteotomy guide are both plastic rather than metal. And the reason we offer this is it's a lower price point considerably, but then it's also something we can make very quickly if you need to get to surgery fast. So since this is a surgery video, let's get right to it. This is the surgery mat, as we always send with every GuidedSMILE case. This is essentially your cookbook for the surgery, moving from left to right, the pinning to the abutments and the surgical guide, and then the bottom area is for the implant information and the guided kit. So it's a very helpful tool. Rather than thumbing through a big book that comes out of the software, we organize it for you in this summary of the surgery. And then the mat part of it is what you set on the counter to organize all your componentry for a quick grab and go. This was a double arch surgery, but we're just going to cover the lower because this is what was really documented well. So as always, you're going to try in the pin guide, and you're going to make sure that it seats on the teeth very well. There are occlusal windows that you'll verify that they're intimate with the teeth. And then you'll remove the pin guide. You'll lay a labial flap all the way down to the apical part of where the fixation base was. Right, you could mark that with a surgical marker. And then you'll bring the pin guide and fixation base back to the mouth assembled. And when you assemble them, you'll use these little pins. They're called stacking pins, 1, 2, 3, and they are reusable, autoclavable, and that is what holds the stacking componentry together. Then when you are going through the process of pinning, you'll use a SurgiMat image here, short, 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 short. So they're all short pins. They will come from our guided kit, our guided fixation kit, which has corresponding short and long drills, and even drills that even have a step down for the cortical plate so that the pins can be tapped in. So just follow along with this. You'll hold the pin guide firmly down on the teeth during the drilling and pinning. Staff member can hold it down, never let up during the entire drilling and pin process. You don't want it to teeter. You don't want it to lift. Otherwise, the entire surgery is off, right? Everything will be off. So hold that firmly, and you'll drill, pin, drill, pin, drill, pin, drill, pin, and go through that process. And then once all the pins are in, then you'll do a tapping procedure. And we have nice videos that show it in action, the exact process, very helpful. But the important thing is that you hold it down the entire time and don't tap until you have all 4 pins in place. All right, then you can make a quick inspection using that same image to make sure that the fixation base looks like it has the same relationship with the bone as it does in the image, because as you know, we use floating guide technology. We never touch bone with the fixation base so that you can engage undercut. Well, so that you don't have to engage undercut, but it just passes straight down. And the pins are what hold the fixation base in place by diverging trajectories. Once the teeth are extracted, then you will reduce the bone. The bone leveling plane is the top of the fixation base. So once the bone is leveled down to that fixation base, then try in the carrier guide. The carrier guide serves a bunch of purposes, but one of them is to make sure that you reduce enough bone. All right, so as long as it fits, doesn't wobble. If it's wobbling, then there's something holding it up, either tissue here or bone. There could be some bone down inside of the little chrome GuidedSMILE boxes here, but you see it's up right here, so something is holding it up. So address that first, probably bone. Make some more adjustments until it fits, and then move on to the osteotomy guide. Now, in a LITE, the osteotomy guide and the carrier guide really are the same platform, so you could do the same thing with the osteo guide. Use it to make sure the bone's been reduced. All right, and then at this point, there is a visual, if needed, on the wall that helps just to make sure that you can see that there are angled sites in the posterior, straights in the anterior, right? For indexing, key, very important when you are driving your implants. This is the older Neodent guided keyed kit. So there'll be sleeves, and there are sleeves in the new one too, if you want. But we can also make these sleeveless, so they're very accurate. That means the hub of the master drill just spins in the resin, and you don't really need the sleeves in many of these new keyless kits. At this point, you'll reference the SurgiMat again. This will give you implant position. It'll give you the angle. It will also tell you which tool to use. In most cases, sometimes not. Sometimes you have to refer back to your manual, but it should give you that, and it should give you the full drill depth. All right, and that just progresses right through as you complete all your osteotomies. Then placing implants, there is always going to be an indicator for the marking on your driver, right? So in Neodent's case, they have a little round divot that will line up with the notch, the nub, the bar, whatever we have put in there to indicate. Sometimes it's in the sleeve itself, but it will always also be on our outside, the outside of our sleeve, to indicate rotation. Spend some time on that to make sure that the rotation is perfect so that we have accomplished exactly what's planned. All right, multi-unit abutments are in. There is the multi-unit trajectory view. This is topical view. We put a facial view in now as you're looking at the patient. But then you'll notice that even those posterior ones are flared a little bit. That's the way they were planned. So it must have been more than a 30-degree placement planning of the implant. But this is how you can confirm that you're in the right rotation. Okay, maybe depth too, but more than likely it's used as a reference for rotation, so that you can go back and adjust if you are really in a wrong position here on the temp cylinders, either rotating an abutment into a different position, or perhaps rotating an implant and fixing that issue. If everything looks good, then move on. Place your gaskets around the temp cylinders, seat the prosthesis, adjust this if needed, because there are angles back here that are a little tricky. It's really kind of a double angle the way this was set up. Seat the prosthesis, place the plugs, hold the prosthesis firmly on the carrier guide, because the bite has already been worked out, and the carrier guide is putting the prosthesis in the proper bite, and then backfill with stellar material that you purchased with the case. And it's a dual cure, so hit it with a LITE. It will be ready to go in, well, it says full cure 20 seconds, but do a little bit longer. We always do a minute. Full cure, self-cure is 2 minutes. Remove the prosthesis, pick up the rapid appliance, right? You're going to always do 2 pickups with GuidedSMILE, one for the patient to wear, one for the records, or better yet, in 5 months, you'll send the patient home in the rapid, send us the prosthesis because the bite is worked out. Physical bite, wash impression, opposing model photographs. You can even, in a case like this, probably go right to final, not have to do prototypes. Very, very handy to be able to do it that way. All right, looks good. Looks great. Nice work. And that was a GuidedSMILE LITE process. Thank you.